Good morning, everyone. This is Mike Simmons from WKS with your daily coronavirus update.
Morning, everybody. This is the first report that we've done where we're actually recording it. We're going to send it out to everybody. So this is our first report dated March 23rd, 2020. First and foremost, be smart and be safe. The WKS senior leadership team wants to remind you that the coronavirus outbreak is really serious and should be taken serious by everyone. If you're sick, stay home and self-quarantine for at least 14 days. If you've been closely exposed to someone that tested positive for the virus, stay home and self-quarantine for 14 days. And if you test positive for the virus, stay home, self-quarantine for at least the 14-day time period until your doctor allows you to return to work. Continue our social distancing, spend time with your family, make this time less stressful by exercising at home, playing games, and educating those members of your family and friends that are experiencing stress from the situation. As with every pandemic in history, this one will end, and we'll see a return to our normal lives very soon. So I wanted to give you a current status of COVID and WKS. As of today, March 20th, 2002, WKS has no reported coronavirus cases amongst the employee population. While it's possible some employees may be in the incubation stage of the virus, WKS has not received any information leading to a confirmed case by any employee to date. We continue to monitor a couple of incidents that have been reported to us, but there's no indication at this point that those employees will test positive either. The current status of COVID-19 in the world and in the US, I think that these are probably some statistics that are pretty important to all of us. The world number of confirmed cases of COVID-19 as of this morning stands at 353,766. The number of deaths related to the COVID-19 virus worldwide stands at 15,419, or a mortality rate of about 4.3% outside of the United States, and that's a key piece of this. The number of confirmed COVID cases in the U.S. stands at 35,345, with over 48% of the known cases in the United States in the state of New York alone. California has about 1,802 confirmed cases, representing about 5% of the total number of cases, and that's in a population in a state of over 40 million people. The United States as a whole accounts for about 10% of the total number of known cases in the world. In other words, that's a very small number in the percentages when you consider what happened with China and what's happening with Italy today. The number of people that have died in the U.S. from COVID-19 stands at 471 people, or a mortality rate in the U.S. of 1.3%, which is substantially less than what's happening in the rest of the world. The current mortality rate is substantially less, and also because there are some reduced reporting requirements that are happening in hospitals, and I'll talk about that in a minute. Italy has the highest number of deaths due to COVID-19 in the world, followed by the origin of the virus, China. There are many reasons for this, to include the protocols that were used in the beginning of the outbreak, the large number of infected that traveled to Italy and from China early on, and the demographics of the Italian population with some other associated factors. The U.S. took early steps to limit travel to our country, and that may be one of the reasons why the rate of infection and mortality rates are so different. It's important to know a couple things about COVID-19 that are specific to it. It's estimated that 5 to 10% of the people with coronavirus will become very sick. The balance of the 90 to 95% will experience milder to no symptoms and will fully recover in about 14 days. We do not know the actual percentage of very sick people because we don't know the actual number of infected. However, if the number of sick people is actually higher, and the medical community believes that it is today, that only reduces the average number of people that will become very sick or possibly pass away. The mortality rate may actually be much lower than 1.3% in the United States. I'm going to give you some information about COVID-19 as a whole. For the first time in a week, the trajectory of the virus cases in the U.S., as of this morning, began a slight change toward what they are referring to as flattening of the curve. Flattening of the curve is the term used to describe a positive change in the trend of the number of cases reported, which could be a sign the disease is slowing down. We need to watch the mortality rate numbers for any spikes that could change in the trajectory, and we'll be monitoring that over the next 4 or 5 days. The medical community is changing the way that it tests for the virus. Only people that are very sick, medical professionals, first responders, and nursing home staff will be tested for coronavirus. This decision was made because the outcome of a test doesn't really change the way people who are sick would be treated, so the test really wasn't important. The decision to stop testing everyone will change the number of reported cases because some people with the virus will ultimately be sent home without a test to self-quarantine and treat themselves. It is expected that the total number of cases in the U.S. will never be fully known due to a change in the way the testing will be handled. Some hospitals are reporting shortages of critical supplies, and several stories over the weekend confirmed that a black market has emerged where hospital staffers and thieves are taking the supplies and selling them on eBay and other sites. Several high-profile arrests were made over the weekend, and the National Guard has been deployed in several key states like California and New York to protect the critical needs supply chain for the equipment and other things that will be going to the hospitals. There were 3 things that came up over the weekend that are really important for the medical community, and then I'll end the report. Important information from the medical community is that Dr. Oz, and everybody knows who Dr. Oz is, was interviewed over the weekend. He's working with a very knowledgeable French scientist to test the use of 2 common drugs together that have already demonstrated some positive results in killing the virus in 5 days. Dr. Oz was very excited at the early results and said this could be a quote-unquote, his term, game changer. The 2 drugs are chloroquine and Z-Pak erythromycin. The World Health Organization launched a similar study today, and the results of the study are expected by the end of the week. Some hospitals are already deploying the 2-drug combination to combat the virus, and doctors believe this could disrupt the trajectory of the virus until a vaccine can be created. Dr. Anthony Fauci, who is the doctor everybody's probably seen every time President Trump does a press conference, he's the leading doctor on the federal government's COVID-19 task force, and he said Friday that the kinds of mitigation issues that are going on right now, the things that we're seeing in this country, this physical separation at the same time as we're preventing an influx of cases coming in, that he thought that was going a long way to preventing us from becoming another Italy. And then finally, the U.S. Surgeon General said, actually this morning, that this week was going to get bad. And it's because we're at the end of that 15-day time period that President Trump and his task force identified as probably our highest trajectory or peak period. So it's going to get bad but the 15-day plan is working, and we need more people to comply with social distancing guidelines. This week will be a critical time period for the development of the virus in the U.S. That's my report. If you have any questions, you can send me an email, mike.simmons@wksusa.com. Thank you.
Great. Thanks, Mike.